A lot of hype around the news item that a drug has managed to miraculously make cancer disappear from all patients treated in a clinical trial, which is why I, Dr. Nitin Yashas, Medical Oncologist, would like to provide you more facts on this story to tell you just how much is hope and how much is hype. So how do we do response assessment in the treatment of cancer? Now, if a decision has been taken to start treatment with chemotherapy or radiotherapy or a combination of both, with the plan of surgery being at a later date, we usually do a response assessment with some form of imaging, be it a PET, CT, MRI or any other form of imaging after a certain number of cycles of chemotherapy to see essentially how much the disease has reduced or shrunk, and in fact, if there is no evidence of disease seen on the scan, we use the term complete response. But even if the disease has shrunk dramatically in certain types of cancer like breast cancer, we would still go ahead and operate with the intention to cure the patients of cancer. And in the surgical specimen, if the pathologist does not find any evidence of cancer cells, we call it pathological complete response, meaning all the cancer cells have been killed by the chemotherapy given before surgery. In short, what I would like to say is that achieving a situation where there is no cancer visible either on imaging or on the pathology specimen is not a new phenomena, and we are already achieving this in a proportion of patients in cancers such as breast cancer treated with chemotherapy or targeted therapy, or even rectal cancer when treated with chemotherapy and radiation therapy, or even Hodgkin's lymphoma where after chemotherapy we do not see any evidence of cancer on the imaging. So the next question most of you are asking is it possible to achieve a complete response even in stage 4 disease, that is when the cancer has spread to other organs in the body? And the answer is yes. Now, in a disease like Hodgkin's lymphoma, which is a tumor of lymph nodes in the body, with just simple chemotherapy, we are able to achieve complete response in a high proportion of patients. But with solid tumors such as lung cancer, kidney cancer, or even stomach cancer and colon cancer, which is stage 4, the results with conventional chemotherapy were frankly disappointing and poor. That is where immunotherapy has dramatically revolutionized the management of cancers. So what is immunotherapy? Let us understand that cancer cells are very clever and they express a protein which prevents it from being attacked by our body's immune system. Now, immunotherapy are medicines which are given intravenously, which activates our body's immune system to go and fight these cancer cells. And in a certain proportion of patients, we are able to see a complete response on imaging, where even in a stage 4 cancer, the disease has completely disappeared and we are able to see survival prolonged in terms of years. Something which we would never have heard of before last decade. But it's not that immunotherapy works in all patients. It sometimes works very well in patients in whom a marker called PD-L1 is expressed in high quantities, or it works in those in whom there is a deficiency in the mismatch repair system known as the MMR system, which is a repair mechanism of DNA errors in our body. So keeping all this in mind, let us understand what this current study looked at. It was a phase 2 trial conducted on 16 patients of stage 2, stage 3 rectal cancer treated with immunotherapy. And yes, all these patients achieved a complete response on imaging and endoscopy, but we need to understand that the follow-up time period is short and only 4 patients have managed to cross 1 year of follow-up and continue to remain cancer-free. While all the others are also cancer-free, they have still not crossed the 1 year mark. Now let us remember that for a drug to be approved, it's usually a phase 3 trial where it is compared against the usual standard of care and in a trial in which more patients are enrolled. Also, the study enrolled only MMR deficient patients. As said before, immunotherapy has already been proven to work very well in MMR deficient patients. But let's understand this fact that if there are 100 patients with cancers of the colon and the rectum, it's only 10 to 15 of them who would have deficiency in this MMR system. Therefore, the study finding may be applicable to only a small subset of patients. Why this study is path-breaking and offers hope is that traditionally rectal cancer is treated with a combination of chemotherapy, surgery and radiation therapy, while this study shows that in a small subset of patients we may be able to avoid surgery and be able to give only immunotherapy. Therefore, we need to understand that these study results are not applicable to all cancers and we cannot generalize it to all types of cancer. Therefore, if someone is diagnosed with cancer, it is still imperative to take treatment at a center which has a multidisciplinary specialties, because at the end of the day, it's only teamwork that makes dream works in this battle against cancer. My humble request to my dear friends in media and news outlets and even celebrities that with great power comes great responsibility, and when sharing such news, it is important that one does not use clickbait headlines and reports it in a very scientific and accurate manner to prevent false news and false hope from spreading. Thank you.